Hello, welcome back to MetaMe. Today we're joined by Dr. Dafashy, and my name is Ritika.
My name is Trija.
And my name is Samira.
So let's get started. First off, what is your doctorate type?
Hey, I am an MD.
Nice. And what specialty do you currently work in?
So I practice in family medicine.
Okay. And do you work in a clinic or a hospital?
Yeah, I'm completely outpatient, so I just work in a clinic. It's actually my own clinic that I opened just this last year.
Great.
So what was your education to become a medical professional? So what did you get your bachelor's degree in, and where did you go to med school?
Yeah. So I did my undergraduate degree at Rice University in Houston. I got a Bachelor of Arts in Cognitive Sciences. I actually didn't go into college thinking I wanted to be a doctor. It's just kind of something that I realized I was drawn to. So initially, I was looking for an English major, and then I ended up realizing I did not like anything in in the English curriculum, and then switched to what's called cognitive science. And that's kind of like an interdisciplinary major, and then I just did my pre med on the side. And then I actually did not get into medical school when I applied my senior year of college. So I did a master's program after that at UNT, which is in Fort Worth, Texas. And I did a master's of science in medical sciences. I chose to wait to apply again because I really realized I needed to build up my application, um, which everyone should not be afraid to do, to take a few years off before you can go to medical school, because it was probably the best thing that could have ever happened to me. I did some research in Galveston at UTMB, in Galveston, Texas, for a few years, and then I went into medical school at Texas A&M, which is in Bryan College Station, also in Texas. Everything I did was in Texas.
Mhm.
Um, yeah, and that's kind of been my journey so far, or up to that point.
That, how many gap years did you have between the
Yeah.
senior year of college?
So basically, it was 3 years. So 1 year of doing that master's program, and then 2 years of working um, as a researcher, just doing bench research.
Mhm.
Um, and I'm a really big proponent of non-traditional ways of doing things, because everything about my path to where I am today has been pretty non-traditional, and I think it really makes you a unique candidate when you do apply to medical school, because you have some real life work experience, you have other experience outside of just college. Not to say that my peers who did go to medical school out of undergrad, did poorly. They did great too. But it's nice to have kind of the mix of experiences in a medical school class. So I think if you're someone who wants to take a gap year, whether because you didn't get in, like me, or because you just want to take a few years to travel or do something else before you really start that medical training, which it's a long term commitment. I highly recommend. It's not going to hurt you. Don't be afraid of taking a few years off. You have your whole life ahead of you, so no need to rush.
Yeah, definitely.
Mhm.
And so with becoming a family medicine doctor, how long was your residency time?
Yeah, so family medicine is 3 years. So yeah, I did that straight from medical school.
Mhm.
Um, I didn't choose to do any kind of specialty, which traditionally in family medicine, a lot of people don't tend to do any kind of subspecialty training like fellowships after residency. Um, so I decided actually to just open my own practice right out of residency. So yeah, just the 3 years. I say
So
just the 3 years like it was like it was a breeze. It was not a breeze.
yeah,
It was a long 3 years, but yeah.
what was your motivation to choose family medicine?
Yeah, as I went through medical school again, I didn't really know what specialty I wanted to do. and I found that every rotation I went through was just so interesting, and because I had such a hard time picking, I realized maybe I just like a little bit of everything. And that's the beauty of family medicine is we train in a little bit of everything. So we're very broad specialty. Even throughout residency, we're just constantly rotating through, every specialty out there so that we have some knowledge for everything so we can handle anything that walks through our door until it requires, really specialized care, and then we would refer them out.
Yeah.
But I love that. I love that I could have anyone come through my door and be able to handle it. Even if just family and friends had a question, I knew I wouldn't be, as a specialist. They are so focused on their specialty. They forget a lot of the other stuff they learned in medical school. And I mean, that's fine. But I really wanted to be able to be that person, that go-to person to answer all the questions. And also, I mean, if you can't tell, I love talking to people and I just, love the relationships and people's stories. And you really can't get that anywhere else outside of a primary care specialty.
Hmm.
Whether that's family medicine or internal medicine or pediatrics, those are kind of like the big three.
Yeah.
I liked family because I was getting to see both kids and adults.
Yeah. It's definitely nice to have a bit of everything.
Yeah,
So, what would a typical day at your job as a family medicine at your own practice be like?
sure. So my practice, I will say, is a little different from a traditional family medicine practice. So I might answer this question from the traditional sense first,
Okay.
which is, traditional family medicine clinics, they're probably open maybe 8 to 5. You get there in the morning, maybe chart check who your patients are going to be that day. Family medicine doctors will traditionally see anywhere between 20 to 30 patients a day, so it's pretty intense. You're kind of going back to back patients. Each visit is probably just 15 minutes with the actual patient, and then you take care of them, do what you need to do, order any labs or medications, send them on their way. And then you see the next patient. You kind of just keep running, running, and running until the end of the day.
Hmm.
And most family medicine are primarily outpatient, although some family medicine doctors will also do hospital care. So, before I started my clinic, that was my traditional day was, get there, do the clinic, and you're done at the end of the day. Um, Sometimes because there's so many patients you see in a day, there's not a lot of time to finish your notes. So sometimes there's a little extra time you need to do after your workday to finish your notes. Um, but so what I did is so I didn't like that system. I didn't like the rush. I felt like patients weren't getting enough time. And again, I like to talk to people, so I really wanted to give them more time. So my clinic gives every patient 30 minutes to an hour long visit. So still same primary care setup. The biggest difference is I see less patients in a day,
Hmm.
and my patients have a private number to me where they can text me or they can call me, they can even email me, and we can do visits that way. So my clinic operates under this model called direct primary care, which is a little different. And so in direct primary care, we're all about giving patients a lot more time and a lot more access to their doctor, kind of how medicine used to be like way back in the day. Um,
Hmm.
has just kind of gotten chaotic now. But so, yeah, my days now will be a mix of a lot of telemedicine, maybe one or two people in office, like very, very little people in office. Everything else is just handled online because actually a lot of primary care you can handle virtually, which is
Hmm.
nice for both the patient and the physician.
Yeah. And I mean, you've talked about how much you love your job, so this question's probably pretty easy, but do you have any specific pros of your specialty?
Yeah. I mean, yeah, from what I said, for family medicine, it's the relationships you build with people, getting to kind of go through those lows and highs with them, and it's different from, say, like a surgical specialty where you really get the satisfaction of fixing a problem in the moment. There's kind of a delayed gratification with family medicine. You have to be okay with like going on a journey with patients and taking time to fix their blood pressure or their diabetes or their cholesterol. And I love going on that journey with them. And I feel like that's actually much more rewarding to me than getting a quick fix. And that's just, personality. That's just what I like. And again, I just like the variety. I don't feel like I'm seeing the same thing day in and day out. Every day's different. Every person is different. I'm always learning, which I'm like a lifelong student, and kind of in medicine, I think you have to be a lifelong student. But I think if I don't know something, if some patient walks in with something new, that's a great chance to learn about a whole new, condition or a new treatment. So I love that. I feel like it keeps it interesting and never changing.
That's really true. I like how you said it's like always a learning experience as you're in your career. Um, yeah, very well said.
Mhm.
But are there any cons or any obstacles you face in your day-to-day life as a family medicine?
Yeah, absolutely. Yeah. Family medicine, because we're primary care, um, with the traditional way most clinics practice, not so much with my clinic. There's
Mm.
a heavy burden on primary care specialties in terms of administrative work, meaning paperwork that you have to do,
Oh.
if patients, use their insurance to pay for something, the insurance might deny it, and then you kind of do this back and forth with the insurance company. And all that non-clinical time can take away from clinical time spent with patients, going back and forth,
Mhm.
signing papers and sending documents. So a lot of primary care um, clinics that like physicians might feel overburdened by that. And there's a shift. I mean, there's some like laws right now that are trying to be passed to kind of reduce that amount of work physicians are doing. And then also, a con might be if you're someone who really likes to dive in deep to um, a specific topic or disease, sometimes you just don't have the time because of how many people you're having to see in a day. And you
Mhm.
end up just referring them out to a specialist, which can feel like, oh, I've been trained to like manage this stuff, but I don't have time. And that can be really frustrating. And so I'm a huge proponent of direct primary care, which is again, that's my business model. It's all over the country. And I strongly encourage anyone who's considering primary care to just look into it as an option and to not shut the doors on primary care because of what they might hear of the admin or like the administrative like burden that they carry or how many patients they have to see in a day, and see that there are alternatives and that there are other people practicing primary care and not having to deal with kind of those downsides.